Now, let's talk teeth. If you're up brushing your teeth this morning, the British Dental Association has said that NHS dentistry is hanging by a thread as waiting times exceed 2 years just for a checkup.
NHS dentistry in England and Wales has lost the equivalent of 8% of the total workforce due to the pandemic, with many practices now struggling to return to normal service.
Well, let's talk to Dr. Paul Woodhouse, general dental practitioner, and he sits on the board of the British Dental Association. Good to see you this morning.
Good morning.
I mean, look, 2 years wait for an NHS checkup is obviously no good at all, is it? I mean, is it ever going to get any better?
Oh, it's ridiculous, isn't it? You're supposed to be a first world country with a decent healthcare provision for our population. Waiting 2 years to get your teeth looked at is frankly ludicrous. But I'd contest the fact it's down to the pandemic. It's a snowball effect of the pandemic on top of a very, very poor NHS contract that needs urgent change.
So what is going to make the change? I mean, what will achieve any sort of change now? Because people have this idea that dentists just want to go private because they can make more money doing that.
Yeah, that's the unfortunate portrayal in the media, is that dentists are the bad guys and we're just after driving Porsches and living in £1 million houses. The honest truth is only government can change the contract. The contract we work under was introduced in 2006. The Health Select Committee said it wasn't fit for purpose in 2008. I'm not the best at maths, but that was quite a long time ago. And since then, government has piloted and prototyped various ways of trying to change that contract. They've ditched every single version because at the minute they've got a system that controls the spend on dentistry and limits the access of patients. And that seems to be a comfortable position for them. But if dentists leave the service because they can't tolerate working in it anymore, we look like the bad guys and the government don't get any hassle.
I mean, the problem is, though, for a lot of people, it's very hard even to track down an NHS dentist now.
Yeah, absolutely. One of the limitations in the contract is you can't actually just set up a dental practice. You have to be commissioned by a local area team from the NHS England. They have to allocate a pot of money and funding to you to provide NHS care. So an individual dentist can't strike up what we used to call a squat practice from scratch. If they don't commission the services, then there is no provision of services.
So just to get that straight for everybody listening and watching as well, is the reason that we don't appear to have enough NHS dentists, is it because there isn't enough, not enough money is being provided to make those practices work?
Absolutely. Historically, funding for NHS dentistry has only covered about 50% of the population anyway. Most of that funding now comes from the patient charges that are collected. So they're essentially a tax on getting your teeth looked at from the government. And if you are a young up-and-coming dentist fresh out of university, you want to provide NHS care, unless the local area team wants to commission NHS care, you cannot do it.
Well, it's a false economy, isn't it, in the sense that it's all well and good if people can't get the treatment on the NHS, they go private. But, of course, a lot of people just can't afford to and won't do that, so they're going to end up with very expensive, severe dental problems a few years down the line.
It's stupid, absolutely stupid. I've had patients who've had to use their winter heating payments to pay for dentures and things like that, and that's on the NHS with the NHS charges. It's a ridiculous system. The only people who really suffer in this are the patients, and that's just not on.
So are you effectively saying that NHS dentistry is the poor relation within the NHS?
Yeah, if we were the Cinderella story, we wouldn't even be Cinderella, we'd be the broom locked in the cupboard.
Gosh.
Blimey heck. Well, can I ask how this affects children? Because there's always been a lot of concern about the dental health of children, because if they start off badly, then that's the rest of their life down the pound when it comes to their dental health. Presumably this is going to affect children pretty badly, isn't it?
Yeah, I mean, the current drive is we've been not ordered to, but encouraged to see urgent cases in children only and prioritise that over the care of our regular patients who, in my case, I've been looking after for 20 years. And so hopefully the children aren't getting left behind. But if people aren't providing NHS care in an area and parents can't afford to pay to go private for whatever reason, I mean, cost of living's going through the roof at the minute. And if you're prioritising heating versus eating and getting teeth looked after might fall down that list of priorities. It will set up problems for the future. And you're right, the longer you leave a dental problem, the more complex it becomes, and complexity brings cost.
Yeah, OK. Dr. Paul Woodhouse, a dental practitioner, good to see you this
great
morning.
To talk to you.
I mean, it's just one of those issues, isn't it? That, I mean, you can forget about your teeth for a while. People can put it to the back of their mind, but you've got to look after them.
Oh, no, when they hurt, and you have to have a dentist.
Yeah.
I live in a village where there is a dental practice, but it's private, and they want to take NHS patients, and they cannot get the funding from the NHS to do so. We've got the local MP on it and everything, but still nothing's happened.
Yeah.
So that's a situation where a dentist wants to be able to take NHS patients, but can't.
It's all well and good if you can pay for private, but of course so many people can't.
And it does mount up. It gets very expensive privately.
Very quickly, yeah.